Hello, my name is Pauline RN. Welcome to my channel. The title of my video today is Death and Dying, Questions and Answers taken directly from RN Nclex. This is part 1. Please hit the thumbs up button, please subscribe, and please share this video. These questions and answers are all over the place, so just bear with me. Thank you. My first question. An advance directive was completed. On the advance directive, no code was noted. DNR was noted. What does this mean? The correct answer: the family, the client, completed the advance directive on admission to express a wish that there should be no attempts to resuscitate client in event of a cardiopulmonary failure is the correct answer for DNR. Patient is no code. My next question: what is the definition of terminal weaning from a ventilator? The correct answer is the gradual withdrawal of mechanical ventilation from patient with a terminal illness or an irreversible condition with poor prognosis is the correct answer. Next question. Patient is pronounced dead by the physician. Only a physician can pronounce a patient as being dead. Who is responsible for preparing the body for discharge to the morgue? The correct answer is the registered nurse. My next question is, after the patient is pronounced dead, the nurse will place the identification tags where? The correct answer is on the shroud or body bag. We place the identifications on the right great toe and the left great toe, or on the ankle if there are no toes, is the correct answer. Next question is, how do we care for the body when the patient has been pronounced dead? The correct answer here: we will place the patient in the normal anatomic position. We will remove all soil dressings. Tubes will be removed. All IVs, all Foleys, all oxygen tubings will be removed is the correct answer. How do we care for the family after the patient or even before the patient is pronounced dead? We will, the correct answer, be attentive listener. Ask the family or the patient if they desire a clergy or a pastor. Make sure the doctor is notified as soon as the patient is dead to come and pronounce the patient and sign the death certificate. Nurses should also note the time of death. Very, very important to be placed on the death certificate. Next question, what do we do for our clients who are dying? What's the nurse's interventions? Correct answer, we'll administer IV drips, pain medications, IV. We'll keep our patients comfortable. We will maintain frequent visits to the bedside. The patients will receive continuity of care. We will still be documenting on the patients. So we have to be at the bedside. Make sure the family is seeing that you are coming in to make sure they themselves are okay. Next, let the family know the patient's hearing is the last to go. Encourage them to talk to their loved ones when they are dying. The hearing is the last to go. Patients will be heard as an individual with personal fears, thoughts, feelings, values before death. So we should be at the bedside, allow families and patients to express, verbalize their feelings. Next question, what are the clinical signs and symptoms of impending death? The correct answer, inability to swallow, pitting edema, decreased GI, decreased GU activity, decreased bowel, bladder, incontinence, loss of motion, loss of sensation, loss of reflexes, maybe elevated temperature, cyanosis, decreased blood pressure, noisy or irregular respirations, shine strokes. These are all signs of impending death is the correct answer. What are our kinds of loss or grief due to? Loss of grief is due to what? The correct answer, death, divorce, loss of a body part, disasters, earthquake, hurricanes, fires. These are all losses. This is the correct answer. Kind of loss or grief due to death, due to divorce. Next question. What are the kind of responses due to loss is the question, and the correct answer is physiological loss, psychosocial loss, psychological loss. These are the kind of responses due to loss, psychological and physiological responses. Next question. What is bereavement mourning? Correct answer, bereavement mourning is adjustment time taken following the loss of a loved one is bereavement mourning. Next question, what is complicated grief? Correct answer, complicated grief is delayed grief, is unhealthy grieving. What is maladaptive reaction to grief? What is maladaptive reaction to grief? The correct answer, grief lasting longer than 6 months. Prolonged grieving, suicidal ideation, unable to function. These are the correct answers. Next question, what is psychological grief? What is psychological grief? Example, loss of body part, breasts, legs, eyes, arms, loss of hope. These are our answers to psychological loss. These are the correct answers. Next question. Kubler-Ross stages of grief and dying. There are 5 stages. Do you know what these stages are? The correct answer. The first stage is denial and disbelief, shock, helplessness. The second stage is anger, guilt, sadness, isolation. The third stage is bargaining. Patient expresses fear and guilt. The fourth stage is depression. Patient is grieving at what has happened. And the fifth stage is acceptance. Patient comes to terms with illness. Please hit the like button, thumbs up, please subscribe, please share this video. This ends part 1 of death and dying. Please stay tuned to part 2. Thanks a lot. Have a good day.